What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brozy. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Thanks, everybody, for listening once again to us. Please let us know if there's any health topics you would like for us to talk about or discuss. Send us questions, comments. Again, thank you. Pass the word to everybody also. Anybody you think would be interested in the content that we're putting out there. Today, we want to talk about oral health, and that is so extremely important because a lot of chronic disease can be the cause of oral health, and oral health can be the cause of a lot of devastating chronic disease also. So it's like a two-way street.
Yeah.
So, and it's a big part of health. And I can't tell you how many patients I know like don't really go to the dentist that often. They usually go when they have an issue, with their mouth, usually some type of tooth pain in their mouth. And that's really not the way you want to do it. Prevention's the best cure, and especially with your dental health, because your dental health is such that it can rapidly degrade. The nice thing about it, it can rapidly improve also.
Okay. So it's not too late.
Yeah, no, and it's really never too late. But specifically, what I want to talk about today was periodontal disease and gingivitis. And just so people know, they're kind of two separate things, but it's really a progression. Gingivitis is inflammation of the gums. Periodontal disease is severe inflammation of the gums. You can really just think about it that way. And so severe such that it's now getting into the tooth root and affecting the bone and stuff. But think about it as inflammation of the gums. And one of the ways that you know that you have this is if you brush your teeth and you're constantly finding that your gums bleed, or if you floss your teeth and you find that your gums are bleeding. This is a sign of definitely gingivitis and periodontal disease or periodontitis. The numbers are pretty astounding to me. 20% of people over 65 have periodontitis or inflammation of the gums and that root socket, and more than 50% of people over the age of 30 have this also. So it's a big deal, and it really just begins with tooth decay. So that's one of the reasons why you want to see a dentist. So we're just talking about, your run-of-the-mill cavities are also signs that this is what can possibly go on. It's really interesting how this process works too, because your mouth is the beginning of your digestive tract, and there's a lot of flora in your mouth, like a lot of bugs in there, and some are really beneficial, some are really not beneficial, and it really depends on what you're putting in your body based on your diet, right? So if you're eating high sugary foods, you're creating a bacterial flora in your mouth that just makes decay progress at an accelerated rate. You're promoting it by eating foods like that. And then if you tend to eat whole foods, now you're creating a bacterial flora in your mouth that also will help prevent cavities and so on. So yeah. Diet is a huge part of that.
Well, you think that high sugar stuff, or processed sugars in particular, like a candy type thing, you're just giving yourself like an acid bath for your teeth. Yeah. And then you think of eating healthy, eating a well-rounded diet, and you think about all the, I wanted to say challenges, but the high quality interactions your mouth and your teeth have with like various types of food, and how that can impact, your jaw health, your gum health, all that sort of stuff you're talking about with the flora, of course, but even just, in the long run of, thinking about just eating Skittles type of, eating something with that type of texture versus, you have a broccoli, you have like a mashed potato type thing, a chicken, like everything is going to be kind of a lot more well-rounded for your teeth and gums as well.
Yeah, your point is well taken, because if you're eating sugary, sticky stuff like sticky candy, like you said, Skittles, I mean, that stuff will stick to your teeth, and within a few hours, it's causing destruction of your teeth.
Yeah. I was eating some gummy bears the other day.
Right, like gummy bears.
Like I gotta stop doing that.
Right. And so that creates like an acidic environment in itself. But then if you're doing like sugary sodas on top of that, not only are you getting the acidity from the soda, you're also getting it, you're bathing your teeth in a sugary environment also, which then promotes bacteria to the bacteria that help degrade your teeth.
Yeah.
It makes them really happy to do that.
Yeah.
The other thing that you just brought up was a whole foods diet is high in fiber. That is basically the the Paleo Man toothbrush fiber, right? So every time you eat fibrous foods, you are cleaning your teeth by doing that. So
I like
whole
that
food.
thought. You could tell in like Game of Thrones or medieval times who was healthy or who wasn't healthy based off how bad their breath smell.
That's right.
There's probably some truth to it.
Oh, there's definitely
Yeah.
truth to that. There's definitely truth to that. So so that's a huge part. That's the foundation of just good general oral health. And then of course, getting in the habit of brushing your teeth and then flossing. And typically they recommend brushing your teeth at least twice a day and flossing, once a day or once every few days, and that can be tricky, right? Because somebody who has gingivitis or the more severe form periodontitis, they do that. It can be really painful and their gums could bleed and stuff like that. So you really have to pay attention to, being careful with it, which speaks to like what kind of toothbrush would you use? And typically the softer bristles are usually the best. I also tell people that, based on the studies, like doing a manual toothbrush where you're brushing yourself with a brush is not as effective as one of those vibrating sound toothbrushes that you can use. And then flossing is great, but it's not as effective as like the water flossing, like the water pick.
Yeah, the water pick. Yeah. Terrific when you got braces, let me tell you.
What's that? Oh yeah.
Oh my God, it's a lifesaver.
Yeah. No, I mean it really does help.
Keoni, I think you might be one of the only few people that knows this. When did people start brushing their teeth or flossing for the first time? Like when did that become a thing?
Yeah, that's a great question. Culturally, I think it's been around since I think since we've been having tooth problems. So I think, that there's evidence of it. I got to check this, but I think there's evidence of it as soon as we started, coming together and
and got
agricultural
close enough to
groups.
Smell each other's breath.
That's right. It said, hey, you need to brush your teeth.
And now, and from what what would they use? What are some of these? And I don't know if we might be getting to this. I might be jumping the gun, but what are some of these more natural toothpaste? And yeah, I'm probably jumping the gun here, but I do want to hear.
No, you're not. I mean, it's a good question. I was going to get to it, but I think it's a good place to talk about it because it really does talk about it from a natural perspective. So what before the advent of toothbrushes, where it really became a cultural phenomenon, right? What did people do? Well, it was a high fiber diet, right? Now that high fiber diet did a couple things. That whole foods diet, it created a oral bacterial environment that helped prevent tooth decay, right? You start seeing tooth decay really early on. Like I think there's evidence of it in ancient Egypt, right? But then you also see pockets. Like one thing that's fascinating to me, and I visited this place, and it's outside of Naples, Pompeii, right? Pompeii is the ancient Roman town where Mount Vesuvius erupted in 79 AD and covered it, and it preserved the bodies from the way it went out. Yeah. Well, it's fascinating because they looked at the dental health of these people, and it was pristine. For most of them, it was pristine, and they looked at their diet, and it was like fish,
Mediterranean
vegetables.
diet.
Yeah. I mean, they had like really, really good dental hygiene. So it really depends, when you're eating more sugary stuff, and it's going to cause a problem for your teeth. So anyway, so what did people do back then? Well, now there are things that are still in use today that I use in my clinic that will help. One of the things are certain spices can help clean the teeth, right? So like clove bud actually not only freshens your breath, but also is it antimicrobial. A lot of cultures used certain spices, one of them being turmeric, right? Or curcumin. Curcumin from the herb turmeric, if you're eating a diet like a lot of curries that use ginger or these roots that are these spices like ginger and turmeric, it also is antimicrobial and also helps clean your teeth. A lot of essential oils too. A lot of cultures would chew on leaves or things like that would, they chew it up to get the essential oils, which would actually help clean the teeth. This is Listerine at the drugstore. Like there are compounds of essential oils in Listerine, like thiamol from thyme. Chewing on rosemary twigs, chewing on I think the Native Americans would chew on like birch twigs also to help clean their teeth. Another thing that we'll talk about a little bit is in a lot of these in plants and stuff, there are what's called certain kinds of sugar alcohols like xylitol. Xylitol, right now, it's a sweetener. It's a type of carbohydrate sweetener that you find in chewing gum, you find in sodas and everything. Anyway, it helps prevent cavities. You get a little bit of that in the natural world also. So a lot of it was just eating. But somebody, back in the Middle Ages or ancient times who's eating just a real starchy diet and that's all they're eating and they're not getting much of anything else, yeah, they're going to be very prone to cavities. And to help with the pain and all that, you either the teeth fall out or you pull them out or you use something like an analgesic like clove bud or something like that to just help you get through it.
Yeah. You know who Rhonda Patrick is? She's like I forget what her business is called. Found My Fitness.
Okay.
She's got like a PhD. She's constantly bringing at least research to the forefront. Is kind of like how she's known on Instagram, is kind of talking about research and incorporating the day-to-day stuff. She was telling this anecdotal story, I think it was on Joe Rogan podcast a couple of years ago, about her going to which is a question I have for a dentist, but her going to a dentist, them saying she has a cavity, she's gonna have to fill it, blah 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 blah. She said she chewed like xylitol gum for like a daily regimen for like a 6-month window, and then went back and they said the cavity was no longer there. So maybe
and there's truth to that, and it depends on the extent of the cavity, right?
Sure.
So if you have a mild cavity, you can actually reverse it without any dental intervention. Okay. And you can reverse, and xylitol does have some research that shows that it can do it. Guess what else helps with that? Making sure that your diet is sufficient in certain minerals like calcium and magnesium, which have both shown. So you can help remineralize your teeth. There are some really neat things coming out in dentistry where with mild cavities and stuff, they're no longer like drill and fill that whole thing anymore. They will use like adhesives to help promote the remineralization of your teeth. But yes, you can remineralize your teeth. Depending
on a long way from the silver tip.
Oh yeah. I mean, no, the dark ages in dentistry really were like only 20 years ago. Like it's really progressed. I mean, I remember as a kid, like having a mouth full of metal, the mercury metal, which is awful for you. I mean, and really as a child, that's really where you ought to focus on remineralization of the teeth with certain things. And for children, xylitol tastes like sugar, so they're gonna eat that all day. You just give a lot of them, like, with minor cavities, you can just have them chew xylitol gum, and that may really help take care of it. But you need to keep an eye on it, right? So the best thing is definitely have a dentist constantly checking your teeth to make sure that it is okay. So, but what you don't, so cavities are like really the first stage of issue, and then it gets worse. So severe periodontitis. Now we're talking about cavities that are going down into the root of the tooth, and the gums are completely like regressing to the place where the root of the tooth is exposed, and now you're getting calculus built up. And within that calculus, the plaque that dentists will scrape off your teeth sometimes. There's like a whole bacterial colony there, biofilm within that can promote cavities. And then if you don't get that off the gums, it just gets worse and worse. So you really do have to, and then you can lose a tooth, and then you can degrade the bone. And it goes much further than that, Brian. I mean, we're talking about now creating systemic disease, right? So now you're getting this bleeding. You can actually have some of these bacteria get into the bloodstream, and now they can start causing like atherosclerosis, stroke, cardiovascular disease. So because it's really a systemic process, like, right, but it may start from your mouth, and then vice versa. So if you have an inflammation going on in your whole body, it's going to make your mouth worse. So you see that. So somebody who has diabetes, who has cardiovascular disease, respiratory diseases, or just has chronic disease in general, usually you see that it's correlated with poor dental health, and vice versa. So it's a two-way street. Yeah, there's a study. Here's a study. Just speaking of cardiovascular disease, it was out of the Journal of Preventive Cardiology in 2019, and they found that regular oral hygiene was associated with a reduced risk of AFib and heart failure. I mean, that's a simple thing to do. So cleaning your teeth can reduce, chance of heart failure and atrial fibrillation.
Yeah.
Diabetes, that's basically a diet of excess calories in general, right? Or sugary diet, type 2 diabetes, or just eating too much. So your blood sugar is out of control. Well, your blood sugar is out of control. That's gonna just kind of, you can think about it as feeding the bacteria in your mouth from the inside out instead of from the outside in, and that can cause a big deal. So with that being said, the lower you get your hemoglobin A1C in general, the more your mouth is healthier, right? And vice versa. COPD is definitely related to severe periodontal disease, specifically COPD that may be related to smoking. Smoking will destroy your teeth. Smokers just tend to have more severe periodontal disease. This one's really interesting to me because you tend not to think about the brain and oral health, but cognitive decline, Alzheimer's disease are both associated with inflammation, and they found in one study found elevated levels of antibodies to periodontal disease bacteria years before the onset of cognitive decline. So there's so when you have those antibodies, it can cause degradation of brain tissue to where you're more likely to get dementia type illnesses. So your teeth are related. It's your whole body. It's not a separate system. They're completely intertwined, like everything, right?
Yeah, and it's the entry point of all. We've talked about this. How there's only a few entry points to the body with the outside world, and this being, obviously the first and most used,
right?
And it's where all the food goes, or some of your air is coming in, depending, and so on and so forth. So clearly, it's the first order of defense, and everything's going to trickle down to all the other body systems.
Right.
It really makes sense.
There's a lot of stuff going on in your mouth every time you eat. You are creating a slightly different chemical environment every time you chew your food, and you need to have a good bacterial, flora in there that's healthy, that helps balance everything out.
Yeah.
And so it's very important. And I keep bringing this up about the bacteria flora in your mouth, right? Well, one of the new treatments, it's not really new, it's kind of like the old treatment that's now becoming new. It's really making sure that you take a good oral probiotic to keep your flora healthy. So we'll talk about specifically what that is, but that's really helpful too. So the other diseases associated with periodontal disease is cancer, head and neck cancer, pancreatic cancer, gastrointestinal, uterine and prostate cancers. Like, these types of cancers are more common in people with periodontal disease. That kind of is fascinating to me because, again, I think it speaks to, okay, well, what's going on there? Is your body just creating antibodies to the bacteria that are in your mouth that are causing problems, and then that can cause problems to where your immune system goes awry, causing, possibly contributing to cancer? I mean, I know it's, cancer is highly related to inflammation, but that's kind of fascinating to me. Even more fascinating to me than that is autoimmune disease. It kind of speaks to that. People with rheumatoid arthritis, periodontal disease is very, very common in them. And another autoimmune disease, lupus is another one. So if you kind of make the mouth healthier, you're less likely to get these types of things. Another autoimmune disease that really in itself is a vicious cycle for periodontal disease is Sjogren's syndrome. All right, and what that basically is it's basically from a traditional Chinese perspective, and patients will tell you this, it's basically a drying out of the body in a sense. And these patients tend to have severe dry mouth. When you have dry mouth and you don't have your teeth being washed with saliva, you're talking about developing cavities within days of that. It's very important for these people. I see it a lot for people that have head and throat and neck cancer, right? Head, neck, and throat cancer. These people that go through that, usually, the part of the treatment is getting rid of the cancer, and they're burning out their saliva glands, so they don't work anymore. So then now they have this chronic dry mouth where you have to watch their teeth and their mouth health like on a daily basis. And so there's a lot of things that I do in my clinic with that. One of them being, we were talking about plants, right? And how certain things can really help. One of what I do for a lot of my patients, besides the xylitol mouth rinses and things, I will have them do mouth rinses with like cooling green tea. Just make some green tea. And regular tea works too, regular black tea. Both of those have some antimicrobial activity and also can act as a natural mouth rinse. So just swishing your mouth with green tea. There's a study on Japanese men. The more green tea you drank, the less likely you had periodontal disease and the better oral hygiene you had. But mouth dryness is really a significant problem for a lot of people. And you don't necessarily need the autoimmune disease. A lot of people, just older people, have that in general. And so as soon as that starts happening, that's a big issue, right?
Yeah.
And this probably is really common sense, osteoporosis and dental health, right? Teeth being like related to the bone. It's like an offshoot of the bone. And also osteoporosis, you can get a significant degradation of the jawbone. There's certain drugs, osteoporotic drugs, that make it a lot worse, like the bisphosphonates. I think we talked about those drugs on our osteoporosis podcast. And some dentists don't even want to work on you if you're on bisphosphonates and have osteoporosis, because they can't get the bone to heal based on those drugs. And also it depends on how bad your mouth is. So it just does seem like in the research that any type of inflammatory disease, chronic disease, is correlated to periodontal disease. And again, vice versa. Periodontal disease seems to be correlated to other systemic diseases. So the harmful bacteria in the mouth, and there's a number of strains in there, but these bacteria basically, like you said at the beginning, Brian, just create an acidic environment and just degrade the enamel. Mm-hmm. You really get in problems when you have plaque buildup on your teeth, because then you're creating these biofilms, and those are hard. You can't just floss those away, and you can't just brush those things away once they develop. That's why you have to go to a dentist and have the scraped away and taken out. So one of the things that you can do, there's a bacteria called Streptococcus salivarius, right? It's M18, and that is a probiotic lozenge. And so that's something that dentists are now starting to use, that people can take and suck on to help with their oral hygiene. Because really what we're talking about, like we talk about dysbiosis of the gut. I mean, and the mouth is part of the gut, but dysbiosis of the mouth is just the imbalance between good and bad bacteria. And that probiotic lozenge really helps, Streptococcus salivarius M18. And you can find that, and I can get it for my patients too. But in general, most probiotics, just balancing out the gut flora, is going to also help your oral hygiene. Let's see, we talked about smoking, signs and symptoms. well, it's tooth sensitivity. It could be sensitivity to hot and cold. That can be indicative of a cavity, possibly red gumness, gum redness, where you see bleeding, sensitivity from brushing, flossing. Let's see.
Is there like a gold standard, Keoni? Because
as far
for
as
me,
what?
I floss my teeth every night. A little bit of blood sometimes. Every time I tell someone that, a healthcare provider, they're like, don't worry about it, man. That's normal.
Yeah.
And it's like, okay, yeah, probably.
It
It's not happening often. So is there, is there
it's
a
usually
biomarker?
it usually happens more often, but you just have to think. I mean, it depends on how you're flossing your teeth, right? I mean, if you're
Yeah, certainly.
and
So
it depends on the type of floss too. I mean, I've had floss, which is like trying to floss, it's so thin, it's like fishing string that's thin that can cut your gums easily. But for the most part, if every time you floss and you're just putting a little bit of trauma there and you're bleeding every time, then that's an issue. But bleeding here and there, once in a while is not a big issue. But I do think it should be looked at quite a.
And so when you go to the dentist, is he going to run a blood test or some specific look at the mouth and schedule 1 through 4 of periodontal disease, or how are they saying this is for sure periodontal disease?
They're basically gonna do a dental exam, right? Look in your mouth. And basically when they're looking in your mouth, they look for a number of things, but specifically as it relates to periodontal disease, they're gonna look and see if the gums are inflamed, if you have gingivitis. As they clean your teeth, a lot of times people bleed a lot as the dentist is cleaning their teeth. You really should not bleed a lot while they're cleaning your teeth. Also, that can be indicative of gingivitis. And then they will probe around the root of the tooth too and see if you're getting sensitivity there. And that's another thing that they can do. And they can also see if the gum is receded so much that they're starting to see the root of the tooth. You should not see that. Mm-hmm. So a lot of dentists will talk about your gums are receding. Yeah, that's the beginnings of periodontal disease right there. And you want to make sure that you put a stop to that.
Yeah, your toothbrush is huge in there.
What's that?
Your toothbrush is huge there, because we were talking about the electric toothbrushes.
Yeah.
Every time I ask I've had many dental hygienists that are my patients and ask, give me a health tip for my mouth type of thing. It's always, hey, don't push too hard on your electric toothbrush, because you're receding the gum line there. And I know my toothbrush, it has like if you're pressing too hard, this like red light comes on, things like that.
Oh, okay.
So really important just to they instructed me each time I've asked them about it to, like with a electric toothbrush, you place and let the toothbrush do the job. You don't do any pressing with an electric
that's good
toothbrush.
To know. That's good to know. I mean, I from when I can remember brushing my teeth, I kind of had in my head
long ago, huh?
Yeah, right. but again, it's like, the dentist tells you to brush your teeth, so you think, well, the harder the better.
Sure, right.
Right. Like I'm just gonna brush the heck out of them, and
like
the harder the better. Yeah.
Yeah.
But so I'm glad you're bringing that up, because that's true, and it does relate a little bit to the bristles. I know I do it too hard still, because when I brush my teeth, within a week of brushing my teeth, the bristles are flattened. So I really have to pay attention to that, and how firm I'm doing that.
And now, do you know or have an opinion on, and this is something I actually wrote down for us to do a topic on, but those tongue scrapers where you like scrape off this like layer of filth that's on your tongue?
Yeah.
Do you want to be doing that? Do you not want to be doing that? Obviously, seems like if you had bad flora, that may be helpful, but if you've built up this great population of flora, it also seems like not the best thing to do.
Yeah. Well, as a practitioner of traditional Chinese medicine, I don't want my patients to do that, because it gives me a great diagnostic tool by looking at their tongue for what I should do. But yes, there's a lot of bacteria in that tongue coat, and some of it may not be beneficial to you. In general, most dentists will tell you, yes, you should brush your tongue to help with that. But I can also tell you that from a Chinese perspective, the coat of the tongue says a lot more than what's actually going on in the mouth from a Chinese perspective. Yeah. So your tongue should have a clear coat and should not have a thick white coat on it. We actually ought to do it.
Sorry.
we actually ought to do a podcast on it, because if I look at tongues a lot in my practice and mouth. And when I look in the mouth, I'm actually, I'm doing like kind of a first base assessment. Like sometimes I can see frank cavities. Sometimes I can see periodontal disease right away. Sometimes I can see lumps on the tongue that may be indicative of cancer. But I'm specifically looking at it from a Chinese perspective with the coat there. And as they get better, that coat should disappear to where it's a clear coat and your tongue is more pink, not bright red, but it should be a clear pink with a clear coat on it, right? So that you don't see, it's not covered up with film.
Yeah.
And the film,
Yeah.
so for some, that film could be a thick coat of black, which is crazy to see. It could be a thick coat of green, a thick coat of yellow. In older individuals, especially people with systemic disease, especially older individuals who tend to be yin deficient, where, as we get older, we start losing the water, yin deficiency, so to speak. We're not as in balance. We have more yang, more heat. The heat rises, causes the tongue to shrink, makes it red, and the tongue will look really shriveled and red. And you see that a lot in older people. And
that is interesting. You do.
Yeah, you do. Yeah. So we could do a whole podcast on looking at tongues, but your point is well taken, because it does indicate the health of the body, both from a Western perspective, but for me mainly it's a diagnostic tool for me from a Chinese perspective.
Yeah, that's really interesting you say that about, as you age, because you point that out to me. It's almost like every tongue that I see in the skilled nursing facility is like, it's like a half tongue.
Yeah.
It's like, man, that used to be.
Yeah, that's right. Right. Yeah. And you could change that. That's why traditional Chinese medicine, they really look at the tongue to get an assessment of someone's health.
Yeah.
So
fascinating. Yeah.
So the other ways, they treat periodontitis is they'll do what's called a scaling and root planing procedure. And basically what they're doing is taking off the plaque that's down in the root of the tooth or down there at the gum line, and then they're smoothing it out and cleaning it off. They sometimes will treat it with antibiotics, right? Because they want to make sure that, none of this bacteria is getting into the bloodstream and causing other issues. They'll also do what's called a flat procedure, where if it's really deep and you're going to, you may lose a tooth at some point. Flat procedure is where you're just cutting the gum, part of the gum off, to clean out the root deeply. And then what you're trying to do is then hoping the gum will grow back over where they took the gum off. And this is really important with what we're talking about, because there are certain nutrients that can really help accelerate that process of helping the gum grow back, which is like CoQ10, B vitamins. There's some neat studies on that will help the gum grow back.
Helpful when you get your wisdom teeth pulled too, I would imagine, because you got that gaping hole there in your gum. That would be great to fill up as quickly as possible.
Yes, that's right. Yes, and it is really, it's funny because I do, for a lot of my patients who would go through that or even have their wisdom teeth pulled, there are some pre and post surgical stuff that's specifically related to dental health that you want to pay more attention to than what we did when we talked about our surgical protocols pre and post in that other podcast. What else? There are other things. There's some up and coming treatments that I found really fascinating, and two of them are basically conventional treatments. So we talked about metformin on our podcast quite a bit, specifically about diabetes and anti-aging. And metformin really is a great first-line drug for treating diabetes, but it's also it's one of my favorite meds for like slowing down the aging process. But actually, there's some studies on metformin using it topically on the teeth to help with periodontal disease. So it's pretty neat what it can do.
Yeah.
Topically for periodontal disease. And then another thing is they're looking at atorvastatin, which is a drug, a statin drug used to treat cholesterol. But they're also finding that putting that on topically may also help with periodontal disease, and it will reduce the deep pockets of like the gum regression and all that stuff. So those are more conventional treatments. Let's talk about the natural stuff quickly. I know we hit on some of it, but let's just go through that real quick. So we talked about a diet that's low in sugar, processed starches. We definitely want to eliminate the sodas. We want to increase fruits and vegetables, not only for the fiber, but a lot of these watery fruits and vegetables like cucumbers, just watery, watermelon even. I mean, they have fiber and they help wash the teeth. All right, so those things are helpful. Whole grains also with the fiber content in there. That's like a way to brush the teeth also. I found it very fascinating that people who get their calcium through dairy products also tend to have better oral health, and better teeth. Now, and it's fascinating because that mineral calcium can help remineralize the teeth. So will magnesium do the same thing. Then we talked about probiotics, the probiotic lozenge, right? Or something you could suck on, and that's that M18 probiotic. It's called Streptococcus salivarius, strain M18. That's a really good one. Xylitol, that's been shown to not only help clean the teeth, it reduces salivary acidity, it reduces plaquing, harmful bacteria, brings down inflammation in the gums, prevents dry mouth and enamel erosion. One of the things that I've loved, that I've always done, and I knew this way back when, even going through medical school, a really good vitamin to take to prevent periodontal disease is just regular CoQ10. Now we think about CoQ10 as just being pretty much for like a heart nutrient type thing, but oral CoQ10 as well as some topical CoQ10, but oral CoQ10 has found to significantly reduce gum inflammation. Fish oil is another one. It's been shown to benefit tons of chronic disease, but it does seem to have some benefit for periodontal disease also. What are my other ones here?
Go ahead.
Another one is lycopene, right? So lycopene's found, it's a carotenoid. We did a podcast on that when we talked about tomatoes, tomato health and all that.
Episode 58 for some reason. I think I know that.
Oh, okay. So that one, that lycopene can come in supplement, but lycopene is very, very high in what? Tomato paste, concentrated tomato products.
Episode also 55. Been shown,
oh, okay. And there's I definitely want to talk about curcumin, because
we talk about 55 starting. Sorry.
What's that?
That was episode 55 accidentally starting, if you heard that. Sorry. Go listen to the tomato episode.
Yeah. So curcumin from turmeric, it's a culinary spice. It is a great anti-inflammatory. It is also a great, you can do a mouth rinse with curcumin. You can do like turmeric milk. Again, do a mouth rinse with that. It's been shown to reduce inflammation of the mouth in so many different ways. The reason why I like curcumin, there's many biochemical mechanisms for reducing inflammation with curcumin, and it is so safe. So you can actually do a mouth rinse with it, or just eat it. But I definitely recommend a mouth rinse with it if people are really struggling with poor dental health. Some people are just prone to poor dental health too, right? Where they really have to stay on top of it, where others are not. Lactoferrin is another nutrient that can be really helpful here. And lactoferrin is found in high amounts of dairy products, specifically whey protein. And it has also been shown to help optimize the mouth flora. And it has also been shown to, it's antimicrobial, right? So it can help kill the detrimental bacteria in the mouth. And lactoferrin is just like a milk protein that helps sequester iron. And it just seems to have all these benefits to it. So whey protein is one of the foods that have high amounts of it. And then basically support, where you're not really talking so much about treating the disease with nutraceuticals so much, but basically tooth support is making sure your vitamin D levels are good, and making sure you are having adequate calcium also. High vitamin D levels are correlated with better gum health. when we were talking about that flap procedure or having the wisdom teeth removed, B vitamins are so necessary for cell growth and metabolism. So it's really helps regrow that tissue back once it's been traumatized. Folate is included in that also. I mean, can we say any more about magnesium? I mean, we've done a number of
mention. Thank God.
Yeah, we've done so many things on magnesium, but a subclinical magnesium deficiency just is terrible for your body. But it is especially terrible for periodontal disease, particularly in smokers. And smokers tend to be subclinically deficient in magnesium. Vitamin C plays a supportive role in just connective tissue and helping regrow back tissue. So, vitamin C can help. I just have people take it in a multivitamin. Another wound healing kind of support thing, good after a flap procedure, is just taking a supplement with a little bit of zinc in there. Green tea. I like my green tea mouth rinses, but you can also do EGCG, which is epigallocatechin gallate. That is the main active constituent in green tea that has tremendous antibacterial activity. So this is probably why that study with the Japanese men was so beneficial. Just drinking green tea can be helpful. I think it was it was like every added cup of green tea per day seemed to have better improvement in the gingival attachment to the mouth. So based on these studies, you can actually see, I've heard this before, like once your gums regress, that's it. But that's not necessarily true. Your body, if you give it the right environment, it can regrow and help the teeth. You just have to give it the right environment to do so.
It kind of alludes to what we were talking about last episode with the meniscus and the knee and the bone on bone and da, 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 da.
Right. Yeah, exactly.
And all too often we're seeing that the body does have the ability to repair itself. We just have to create that environment.
Right. And then I've had some, patients do this, and in a lot of my herbal studies, it's very easy to make your own mouthwashes, so, and you can make them very easily with essential oils. Just get a good pure essential oils, like essential oils of clove and thyme or peppermint. All of these are antimicrobial and will clean the teeth. Peppermint has menthol in it. Essential oil of rosemary, thyme, thymol. Eucalyptus is another one that you can do.
Go ahead. I'm sorry.
Another one is basil, and specifically like holy basil. And you can add drops of it to water. There are gels. A lot of these things are in toothpaste now. A lot of the natural toothpaste, but just adding that stuff to it is great. And somebody who's having severe tooth pain who can't get to the dentist for whatever reason, having clove essential oil or just regular clove bud that you get at Spice, you can just dab it on the place that is painful and it will numb it out within seconds to where you can cope with it. And the nice thing about the numbing out, it does more than an analgesic effect. It's also antimicrobial in the way it works. So you are treating before you actually see the dentist too. So
now, as far as over the counter type Listerine, Keoni, where do you stand on that? Are these essential oils and different herbals, are they a better option for people more often than not? And how do people make a informed decision on? Obviously, you can go to Walmart and pick up many different types of mouth rinses, and all too often you don't hear about some of these things that you just talked about, or I didn't know anything about green tea helping your teeth.
Yep.
So how does someone go about making that decision first and foremost, like which one they should go about, and then what's your just overall general opinion on some of those over-the-counter products?
Okay. Well, first, since this is one thing I meant to mention with green tea, and you sparked my memory. Also, the thing about tea, the plant Camellia sinensis, which is what most teas, green tea, white tea, black tea, are from. They actually have a high content of natural fluoride. So that may be another reason why it helps with your teeth. All right. So that's something to think about. Now, as far as like choosing a mouth rinse, like the standard one conventionally is like Listerine. Okay. You can find that just about everywhere. And part of the ingredients in there are these essential oils. any type of mouth rinse that you use. Like if you have nothing, just rinsing your mouth with water after you brush your teeth will help clean your teeth. Okay. I am biased again, and as I know you are too, like if we can do it naturally, let's do that, right? So I am biased. I really like the mouthwashes that have these essential oils in there, as well as like are sweetened with things like xylitol, which also helps. One product that comes to mind that I use is a spry mouthwash.
We're gonna make people start paying for these shout outs.
Yeah, I know, right? Yeah, I know exactly. But that one's a great one. It's flavored, like some of them have a cinnamon essential oil in there. Again, that cinnamon essential oil also has antimicrobial activity and also adds taste. But you know, as far as like putting my conventional science hat on, which one has the most studies on it as far as being beneficial? Listerine, right? So as far as toothpaste go,
yeah.
Um,
you want me to use that black stuff I see online? Have you seen those?
Yeah, right. Yeah, yeah. I mean, you know, so again, toothpaste are such that you want to think about things that are washing your teeth. So you can brush your teeth without anything and still get benefit, right? Even if you don't have anything on the toothbrush, as long as
the food and fiber comes into play, basically.
Yeah, right.
Or
It's a mechanical
example,
right?
Yeah.
It's a mechanical brushing of things, right? Just I have yet to meet a dentist, and I know quite a few who have told me that the dental association recommends this type of toothpaste or whatever, right? Most toothpaste that are recommended by the dental association have fluoride contain, you know, have some type of fluoride in it, right? For some people, fluoride, if you get too much of that, it can discolor your teeth. And in my opinion, too much of it is, and I think there's evidence to back this up. So it's more than just an opinion-based evidence. It can discolor your teeth, especially when you're younger. So you really want to be careful with that. The most important thing with cleaning your teeth.
Thank God they were coating my teeth with fluoride. Thank God.
Oh yeah.
Especially when I was younger.
I mean, and I'm not, you know, I'm not saying that is, yeah, same here. And I'm not saying that may not be necessary at sometimes. I mean, sometimes people have where their oral health is so poor where you need to do something right away. Sometimes doing that can be really beneficial. But for the general person, you know, I would just find a toothpaste pretty much. I mean, as simple as find a toothpaste that you like and will use really no matter what's in it. Now, my bias is finding something that has a lot of essential oils in it and you know, tastes good and stuff like that. The one I really prefer is a Himalayan toothpaste. It's an Ayurvedic based toothpaste. And it actually has some other plant compounds in there that have been shown to be beneficial. Like I think pomegranate extract is in there, which also has some research showing that it's helpful for oral health. But it's really finding one that you like, one that you're used. But really, when we get down to it's consistency with any of it, like making sure that you're doing that on a regular basis and getting into the habit of doing that and starting young. Like children really need to start young to build the habit so it becomes like, you know, you just don't leave, you know, it's kind of like you're not going to leave the house without clothes on. You're in the habit of putting on clothes. You need to be in the habit of brushing your teeth before and after you go to bed. And sometimes after every meal, depending on what you're doing.
Yeah.
Yeah. So anyway, I think that's everything I wanted to go over. Is there anything you want to add to that?
No, before we get too long in the tooth, I think that was pretty good.
All right.
I am always, Keoni, I'm always skimming through the video. I don't know if you see, like on YouTube, I put up the picture that's actually like a picture of us recording the podcast.
Okay.
I'm always trying to find a good smile or a good moment. And I can't imagine a better podcast for both of us to display those chompers and make this really easy on me.
That's right. Can you see?
There we go.
I brush my teeth? Yeah.
And now we got the snapshot. Before we do leave, I did think of something else, Keoni. Maybe we should start doing this in each one of our episodes. But so we did the podcast last week on kind of knee health, knees over toes training, and if going over, you know, letting your knee go over your toe is something you should or shouldn't do. Right. Since doing the podcast, talked to many people about it. Like have you heard about this type of thing? Have you heard that before? Blah, blah, blah. Couple of things I wanted to point out that maybe I didn't express in the episode. Going straight ahead seems to be very safe, but we want to have really strong hip adductors and abductors. So basically the inner portions of our thigh and the outer portions of our butt, to keep our knee not having any lateral force, right? So the more we go forward, we do want to be mindful and have really strong butt, really strong hip adductors to keep that knee. Yes, it can go far and bend fully, but we want to keep it in a nice neutral alignment as far as lateral direction goes.
Right.
Another thing someone asked me is, I heard that going over your, knees over toes really destabilizes the knee. So there's just a lot of funny things going around, because like, how does that make any sense at all? But the most important thing that I wanted to drive home is just doing this knees over toes training, really important to ensure your knee is tracking forwardly, not laterally. And if so, there's a variety of things. If it is tracking laterally, there's a variety of things that you can do to really strengthen those muscles depending on which way it is tracking. And I have a ton of YouTube videos with exercises specific to hip abductors and hip adductors, and you can find those on my YouTube. But just like recorded the episode and was like,
no, I'm glad you brought that up, because I had a couple of my clients listen to that podcast and had questions similar to that. So I'm glad you brought that up. Yeah, we probably should do a review. I'm sure something's going to come up with this one that we just did, and just anything we forget to mention. But yeah, very good.
Go back and listen to it. Happy teeth and smiles all around.
Yeah, and happy 4th of July. That's coming up Monday.
Yep. Awesome. And until next time, we will talk with you then. We've been doing this a while, Keoni. I looked up the episode 55, The Mighty Tomato. And that episode came out October 24th, 2018.
Jesus, back in the dark ages.
Yeah. We got to start making some money off this. We got to do something.
I know. Oh, God. That's crazy. We've been at it a while. All right, cool.
That is pretty crazy. When we started this, I lived in Auburn, which is in 2017.
Wow.
So that's nuts. All right, everybody. Until next week, be well.
Take care, everybody. Bye.